right. Good morning, everyone. I'm Kathleen Warshawsky with Seniors Blue Book. We're here today with CC Young Senior Living. Cathy Hefko is going to talk to us about staying in touch with your referral sources, and we're going to have a roundtable discussion. Our agenda for today, we have our welcome, which Jen Griffin from CC Young is going to do for us. We have our short presentation from Cathy Hefko, and then we'll have our roundtable discussion right after that. And let's hear from Jen.
Hello, everyone. My name is Jen Griffin. I'm Senior Director of Community Outreach at CC Young. We're happy to be with you today. Community outreach means that I get the pleasure of working and knowing a lot of different people and departments, both at CC Young and off campus. One of my newer joys is that I've gotten to know your speaker today, Cathy Hefko. Cathy brings 20 years of senior living nursing experience and 20 more years of nursing and public health experience. She is the rare individual who has both left and right brain capabilities. Super creative, has tons of great marketing ideas, and honestly, she's one of the first people I thought of to be with us today. I think you're going to enjoy the discussion we have. And after it's all said and done, if you find you have additional questions for Cathy after the call, please reach out to either of us and we'll be happy to help as best we can. If we can't help you personally, we will help you find the answer elsewhere. So sit back and let's get started discussing staying connected to your referral sources. Thanks.
All right, Cathy, you want to take it from here for us?
Okay, thank you, Kathleen. Thank you, Jen, for the introduction. And I have a few slides here. Hello, everyone. And I'm going to start out for some tips for marketing during the pandemic and staying in touch with your resources. So let's start. Uncharted territory. We are in it. We are in the global pandemic. As we all know, it's tough. You know, there's what, 7.9 million people around the world with COVID-19, and we have 1 million here in the USA, and we're going through rough times. This is definitely uncharted territory for marketing. We all know that marketing is about relationships and being a resource, and you know, we're having to do this social. Didn't think would take this long. It's taking a very long time, and I think we'll have months to come of it. So we can all gather around at the round table and discuss that and come up with our ideas. But I just wanted to start off saying that it's going to be a while until we are able to reach out to our resources like we like to. So for right now, we are using everything digitally, basically, and phone calls. But I want to remind you that, you know, within this, that it's important to recognize where we are and you know, look at our families and see what they're going through. I think number one, we need to recognize, you know, everybody's very stressed right now. All our resources, our referral resources. And I know there's many of you out there that have different referral sources. So I'm going to go over those later. But I wanted to stress that, first of all, we recognize where we are with the stress. And there's a lot of frustration. And so I think the best thing that you can do, you know, at least in my field, looking at it from my perspective, is to be a resource to them in any way you can and listen. And to remind them that your operation or business goes on and it's the same services. It's just more communication, more constant communication, and recognizing that everybody needs to stay calm and carry on. And we'll go into that too. But so I just wanted to go over a few things going on here. So first of all, how do we shift? How do we recognize or readjust our targets? Oops, I moved on. Let me go back a minute. Can I go back? Just readjusting your target audience. I wanted you to recognize that because, you know, you might be in realty, you might be a bank trustee, you might be a lawyer who's in the senior care industry, you might be, you know, working in a different way, a DME company, assisted living. But when it comes down to it, it's about refocusing and readjusting your target audience. So who do you talk to? If in my scenario, in skilled nursing, we were talking mostly to case managers, social workers, and then also families. But we might have to readjust that even more and talk to the family versus the case manager or social worker, because they don't have time. And everybody's working more digitally now. So the whole focus there is I just wanted you to, stay consistent with that and, think about retargeting your audience. Very important. Okay, now we'll go on. Kind of got ahead there a little. Keep calm and carry on. Yes, we all must do that. So I said communication. Well, in order to do that, you have to take care of yourself. In all relationships, you can't take care of people in marketing and your relationships and your high-level referral sources unless you take care of yourself. Taking care of your business, because if you're not calm and relaxed and being able to listen, because most of the time we're listening to people as good marketers, and we have to give ourselves motivation and affirmations and keep us going. So I wanted to talk a little bit just about that, nurture yourself, do things for yourself that can, broaden your horizons and keep you calm and get you out of the house and help take care of you, be it gardening or nature, music, art. Network with your colleagues, very important. I have a great team at CC Young. There's plenty of people to talk to connect with, and we have a great time. We meet every 2 weeks or so. But, if you have your small network of community people that you work with, colleagues, network with them in happy hour, network with your people at work, any way to keep yourself focused and happy at work and maintain so you don't burn out, because it is very stressful during this time. And I wanted to give you an example. I mean, I had a case manager the other day that was so stressed. She happened to call in and she said, Cathy, I have a referral. I said, great. And it was just a text, and I said, how are you doing? And she said, it's insane. It's totally insane. The floor is backed up. We have gunshots from gangs right now. We have protest people that are sick. We have COVID coming in. We have mental abuse coming in, substance abuse coming in right now in the hospitals. I mean, if you're on the front line, it pretty much what comes in through that ER tells you what's going on in the community. And it's a good heads up for all of us to know how stressed out people are, because the front lines are tough. I know social workers, case managers, and nurses and everybody in the front lines is really, really, really having a tough time. So when you have a moment, and ask them, how are you doing? Because that is so important. That's a key connection. That's a moment for you to grab with your relationships and to work with, because anything you can do to relieve their stress, they welcome it. Send a lunch, run by with a thank you note. I mean, just little things, like Mother Teresa says, little things are great things. And, that's what, empathize with them. Let them know that you care and that you're there for them, because they need that right now. A lot of the hospitals are in deadlock, and COVID is the highest it's ever been right now. And so this pandemic is causing a lot of issues down the line, And then there's local businesses that need our help, so we can share and get their help too in marketing. So there's things we can do thinking out of the box. So I'll go on to the next. So keep calm and carry on. I'm gonna let you handle the slides, Cathy. Okay, there was another one about, let's see, remodeling and reorganizing your strategies. So putting on your MacGyver hat is what I'd like to call it. Creatively thinking, how can this be different during the pandemic? What can I do? And that's why it's so good to redesign, your dialogue, who you're going to be speaking to, and how you can help them, and looking at creative ways to reach out. Like I said, notes, calls, texts, everything that you can use communication-wise. And even the hospitals, I kind of follow them, like, too. What are they doing, for families? Because they're at high stress. They can't come to the hospitals, right? But there are some ways that I've heard other assisted livings and independent livings, they have like a room now. And they did have one hospital, I heard they had a room, glass room, isolated. And they let the families talk from one side to the other, through a glass partition so that the family can see the patient or resident or whatever, and there's a microphone on either side and they can talk and see one another, because that connection is so important. And it's not only important, for the patient psychologically, but for their physical quality outcome. It will be a lot better because the patient feels so isolated, or the resident. So a lot of people are doing that, partition rooms basically, and then putting up glass and having a way, kind of like how the hospitals did tents outside the ER. Same way, that's for safety for the hospital too. But, I think we're going to look at a lot of things like that. Mobile, express, people coming in for their tests just through their car. We're going to see a lot of that happening. Again, we're going to have to go to them and reach out to the patient or the resident. It's going to be a lot different. It's not so much they come to us. We're going to be going to them, I think, in a lot of scenarios. And I think even in the hospitals in the future, we're going to see a big change. So customizing the experience, that's going to be real different too. How do you tailor and target, what you're looking at? And what I mean by that is, you always need new information coming out as a marketer, right? I mean, this is, even though it's the pandemic, we need to create new literature. I mean, look at the commercials on TV. I mean, every commercial, they're constantly changing. First, they were talking about safety and hand washing, and this might be Procter & Gamble or Kimberly-Clark or whatever, but they're all using different commercials now. And now they're talking more about family and closeness and relationships and how important priorities are in our life. So they've changed their ad, so ads are changing. So even looking from that perspective, what's going on in our environment with media, and how that's changed, they're customizing. And so we need to do the same thing. Do we need to be talking about COVID to the families and precautions? Maybe a little bit more. Maybe we need to talk about, how we're going to do a special partition so they don't have to self-isolate and they can talk to their families a little more and get out and about. So doing these different things, and then creating your postcard or contact or brochure literature to get out there, and then emphasizing a new program you have. It could be pet therapy, even though pets bring less stress, right? So I've seen communities maybe change, and they're going to emphasize their pet therapy, in assisted living or skilled nursing. Or maybe they're going to have an art gallery and have an art showing or something that families can go by and see, even, or residents, and have it in a separate area so that people can go and look at something. So I think we're going to see partitionings and different isolated things that we can do, and niches that we can develop. Maybe, if it's real clinical, maybe pulmonary is real big right now, and we're going to emphasize our permanent pulmonary unit for the future, right? So these are things that we can do in marketing, always customizing, always taking it to the next level. Again, thinking out of the box, putting on a different MacGyver hat, and looking at the changes that we can do in niche. Okay, next slide. Blessed are the flexible, for they shall not be bent. I just had to put this little slide in, first of all, because I know I need yoga. And then two, also, it just reminds you that you have to be flexible today, always. I mean, I learned that in high school. I think if you don't flex, you will be bent out of shape. You will not be in good shape by the time you're 80. To go with the flow, ride the waves, as they say. So what does our future of healthcare hold? Many changes, new safety precautions, of course, that we are all aware about. And then also, I think, in the future, we might have, hospitals may get smaller. They're looking in the future that people will not be directly admitted to the ER like they are now. Maybe there'll be separate areas for them. Maybe they'll be directed to urgent clinics versus coming to the ER, especially the seniors in the senior care industry. They don't really need to be in an ER. So, I think they'll be looking at efficiencies that way, of how can we triage better and put, a certain sector of patients in a different holding area or urgent care center or LTAC directed admit, or mobile services even to them. Like Parkland, for instance, they do homeless care. They do it through a van. It goes all around the city. They have x-ray lab, everything on that van that they need. They can do pretty much, not urgently, but follow up. And so, testing, and, it goes out to the community. It's a resource for the homeless. So there's mobile services, there's rolling clinics, And I think we're going to just see a lot more mobile. And I think that for all of us, we're going to have to do like an immunity passport at some point. The airport now is checking temperatures, I hear, in LA. They just started doing that. And everything's digital as far as we'll be told, is it green, is it red, can we go, depending on if we have COVID, if we don't have COVID. And immunity passports are being developed. And I think in healthcare, those things are going to happen here too. I mean, I think that we're all going to have to be constantly checked and tested. And I don't think this is going to clear anytime soon. Even with the vaccine, if it does, there'll be another virus to come along. So we're going to have to look at the whole setup of how we do things and be more mobile and have access and keep things digitally running, and just be more aware of what's out there that we can do to help and customize more. But the main thing, I think, just to summarize this whole thing, is to stay personal, make this more personal, because it is so digitalized nowadays that we don't have that touch, and it kills me because that's my nursing background. And so that being able to touch and reach somebody and talk, and we're missing some of that now. So we really need to personalize and look at maybe tailoring and targeting better as customers come to the door. What do you like to do? What are your favorite things? How can I make it special for you? Because really that's what it's about, the relationship, and that's what somebody feels in their heart. And it's not a digital world for human beings. We have to feel it, and we have to see that there's care and empathy there, and listen and provide that nurturing in other ways. And that's it. And we can have our discussion on roundtable that Kathleen's going to give.
All right. Thank you so much for bringing some of those ideas and issues to the table for us, Cathy. Really appreciate that.
Sure.
We are now going to open it up for some of you to share your thoughts and some of the things that you've been doing as well. And I'm going to attempt to put us in gallery view here so that we can, let me just see here. I think if I just unshare the screen, but I don't know that I know how to do that. But let me see. I think if I do this, you'll be able to see each other. Oh, you know what? I can just stop share. That's what I do. Okay. So now I think you should be able to put everyone into gallery view and do it similar to the meetings that we've been able to do. And you should be able to see each other. I do know that Sheila Landry had something that she wanted to share with the group. Sheila, I know you made it to the call earlier, but I can't tell if you're still on the call because there's a lot of people on the call. But if you are here, let me just unmute you. I found you. Sheila, are you there?
Oh, no. Oh, where am I?
So if you're not talking, if you would please mute just so that we don't get a lot of background noise. Here we go. Sheila, can you hear us?
Yes, I can hear you.
All right. Do you want to share your thoughts?
Yeah, I think that one of the things that have been working quite well for me is the Alignable. It's a really good tool for us marketers who can't go from business to business or physician office to physician office anymore. I have been able to make a lot of connections and communicate our services to the community. I don't know if y'all have heard of Alignable, but I'm doing my best to get the word out, because what I've been doing over the past, I think, 3 or 4 months is building my community. And I'm trying to stay focused mostly on the healthcare professionals, physician offices. There's some that, mine is mostly targeted in Denton. There are some physician groups that have joined in. There's some home health, some home care, Jeff Psych for sure. And he could probably tell you a little bit more about Alignable as well. I have actually earned my, what is it called, stamp of approval or whatever for the locals. And that's a really good, little stamp included with the benefits of joining Alignable. So my goal today is to make Alignable aware to you so that you can join in. The first line is free. I don't work for them, but I'm building my community and been pretty successful. The first line is free. I think you can get maybe up to 50, but from month to month as we connect, then we can keep connecting and building to where our community gets bigger and it doesn't cost anything. There's another level that that does cost money, of course, but I think that y'all should take a look at it. It's pretty good.
Thank you for sharing, Sheila. We appreciate that. Does
You're
anyone
welcome.
have anything they'd like to share? I see a lot of people, but I can't tell. I have 3 screens worth of people, so I can't tell if you're trying to talk or not, but please do let us know if you want to speak and have anything to share with the group. I know that there are people out there who've been using social media. Some people have been doing some of the food trucks, events and things like that to get people to come. Kelly, I see you nodding your head, and I know you've been doing all kinds of fun things. So do you want to share a few of the events that you've been doing with the group and let them know which ones have been working for you and which things have not worked well for you?
I've tried multiple different things on social media. That's like our biggest focus, because just like Cathy said, we don't have that personal one-on-one anymore. We're not allowed to do that. And I feel like showing your face is the best way to do it. So I've tried the professional, like the giveaways, the entries. I did those for 1 month. I've been doing some live videos, but I've been mainly just trying to touch our families here at the community. I think that's really what's going to help. Right now, all the professionals, you reach out to them and they're slammed, just like Cathy said, they're so busy. They'll reach out if they really need to, but I think right now we need to focus on the community here. So I've been trying to target more on social media and the actual Plano community, not necessarily professional.
Awesome. Thank you for sharing that.
Mm-hmm.
Does anyone else have thoughts that they'd like to share with the group?
Well, I'm curious. This is Stacy Osborne. I'm just curious if anybody has any data around other things they've done on social media. What have we done and what has worked, or what are the numbers around that? Any data on that? Because I hear a lot of people doing things. I just don't know. I don't have any sense for what might be working better than something else. Anybody have any data?
Stacy, I don't have any actual data, but I mean, I think it's a good target area, and I would probably recommend like going and following people that do use the social media on Facebook and Instagram, because I know that's just with my company, that's what their main target is right now. So I would recommend, you know, going and following these other companies and seeing what they're doing, and you can kind of get a good idea from that.
Just to jump on to what Kelly just said, from a marketing standpoint, the best use of social media time is not in doing a lot of your own posts, because you're reaching an audience that already follows you, that already knows you. It's about going out and figuring out who you need to be connected with, following them, and commenting on their posts to really get to know that company, because then you're going to show an interest and you're going to show a desire to build that connection with them. So it's really not just about posting what you're doing. It's about going out and learning about who you want to develop those relationships with. That's just a general marketing kind of tip.
Well, Angel, I think you bring up a really, really, really great point. This is a time where we all have to support each other. And it's not, you know, no one really wants to hear you saying how great you are and how great your company is. It's a time for other people to step up and talk about how great your company is and the benefits of your company and the services that you have to offer and how that can help. So I think you bring up a really, really, really great point.
Yeah, and to touch on what she said too, think about like when you put something up on social media and somebody makes a comment on it and how good that makes you feel. So when you go out and you start showing interest in somebody else's events and things of whatever they're doing, they're going to see you and be more interested in you. And that's a new connection right there. They're already going to build that relationship online, since you can't do it face to face. They'll get to know you.
I agree.
I think the Zoom calls are really helpful. I think the webinars are really helpful. I mean, you can't be at the in-person networking events, but you need to be on the social media and the Zoom networking events as much as you can to still keep those connections. I know through Seniors Blue Book, I'm still doing my Marketing Mania. So if you've not been attending that, we've figured out how to do virtual bingo on Marketing Mania. And then we're also doing the one-on-one speed networking via the Zoom events as well. And so I encourage you to come and participate in that, because you do get to make those one-on-one connections and have 3 or 4 minutes to talk to someone that maybe you know or maybe you don't know. And if you know them, sometimes just catching up and reestablishing that connection with them and making sure that they know that you're still here, you're still with the same company, or maybe you're not with the same company, but they know that you're a quality individual and that you will be promoting only quality products. And so now it's time for you to share what you're doing with them currently, because it's different than what you were doing before. And so, I mean, I think it's really good to still stay connected in any way that you can, whether it's posting and liking people's things on social media or coming to my Marketing Mania event to do your one-on-one networking. I mean, there's all kinds of ways that you can be doing it. It's just, it's different. And if you are one of those people who doesn't like change, it's going to be really hard for you, but you have to come out of your comfort zone and you have to make pivots and changes. And if you're going to survive in what you're doing. And we all want our businesses to survive and thrive, right? And I think everyone on this call wants to be able to support each other, because all of us support the community and our referral sources and the seniors. I mean, that's why we're doing this, because we love working with older adults and making a difference in our communities. So I think there's all kinds of ways that you can do it as well. DAGS has pivoted also. We're doing our educational programs online via Zoom. Those are still every single month. We have our DAGS Fall Forum is coming up in October. You know, we looked at it over several months. We kept putting it off because we didn't know if we'd all be able to meet or not meet in October. And we decided that even if Texas opened up completely, it probably is still not going to be safe without a vaccine for our senior living communities to be exposed to. And even though the Fall Forum's not in senior living, the people who attend are all working with vulnerable seniors. And so it only makes sense to do that event virtual. Well, again, we met and we talked about what does a virtual event mean. I mean, we're going to have interactive networking rooms for the forum, and I mean, all kinds, an experience kit, all kinds of fun things. And so, again, I just encourage you all to think about different ideas and come outside of your comfort zone and sound ideas off of each other. I'd love to hear from someone else. Does anyone else have something to add to the discussion?
I was just going to add one thing, Kathleen. Maybe surveying families or having a nice survey out there to see what they want, what the needs are, and two, you know, what we can do for our other referral sources, you know, because they know better than us. They have the exact ideas in mind. So, you know, and I think it's always good to get their input and listen to what they have to say too. So, you know, maybe surveys is another way that we could really get some input, because you want to make people happy and have this good relationship. So you have to know, you know.
Another thing that I wanted to share with you all is my husband's grandmother. She's in assisted living in another state. And one of the things that they are doing to help keep everyone connected is they're doing little personal videos. So they do a little video of Grandma Millie and they blast it out to the family, and she can say whatever she wants to the family. But then for Mother's Day, they encourage the families to send videos for her. And they actually took, I think for Grandma Millie, I think we sent 6 videos. They compiled those 6 videos and shared it with her on Mother's Day. They actually videoed her reaction to the video on Mother's Day. And then they shared the compiled video and her reaction with all of us. And they did that for every single resident that lives there. And so just trying to figure out ways that you can help your residents and help your families to connect, I think is going to help your referral sources to see that you are making a difference and you're doing things that are really special for your families. I mean, I'm thrilled with the place that she's at. I mean, they take a tablet to her room, they set it up for her, and then they leave her there for 30 minutes, 45 minutes. You know, they come back and check every once in a while to see if she's done. And if we're not done, they just let her talk some more. And they have been so flexible in making sure that their residents are connected to their family any way that they can and trying to make it special for them. And I think Jenny had something to say.
Hi, this is Jenny with The Place for Mom. Well, I've been seeing a lot of places start to do more drive up sort of networking meetings, and I'm like really excited about that stuff. So I will be going to as many as I possibly can to get out and see everybody again. So your ideas are great. And when I go to these drive-through meetings, or professional referral source appreciation events and things like that, what I'm going to do, because I work with A Place for Mom, is I'll have a list of your most recent leads printed out for you. And so I'm giving you something in exchange. And so I'll be going to the Reserve tonight because they have a virtual happy hour tomorrow. So I'm going to pick up a cocktail. I'm really excited about that. But, you know, everyone's getting so creative, and I think we're going to be fine. We just have to ride this wave a little bit longer, and it's nice to see people face to face again. So I think if people can't get to your community, they still like getting invited to go. So I think keep inviting people. You know, send your referral sources, you know, an email saying, I would love to meet you on the porch on Friday morning for coffee. There are little things like that I encourage, because it's that personal touch. You know, the handwritten notes are always great, and or even a video of your residents doing something. You know, send it out to your referral sources, because you never know, they might post it to their LinkedIn, they might post it to their Facebook, and shout out your community or your service for something. So just keep being creative, you know, hang in there. This is a great industry. We all help each other for the benefit of the seniors. That's why we're all in this industry. So keep being creative and keep doing what you're doing. So, and this is my best week ever, just getting out, because I've been locked in my house for like 3 months now. So.
Awesome. Thank you for sharing that. I do encourage you all, when you go to these events, to please, please, please be wearing your masks and make sure that you're social distancing, just to keep each other safe and to keep your residents safe. As we know, the way it gets into the majority of the communities is through a staff member who's been exposed. Each and every one of us has the potential to be exposed. And so just because we know each other, love each other, doesn't mean that we are the core family members who should be interacting really closely together. So please make sure that if you're not at least, in my opinion, about 15 feet apart, you're putting your masks on and making sure that you're keeping each other safe, so that in turn you can make sure that you're keeping the residents at the communities who are hosting these events safe. The caseload in Dallas has been going up, as we've seen. It's spiking. Hospitalizations are going up like crazy this week. And I know here in Plano, I'll just share this story really quick, and then I'll stop talking about it. But I have a friend, and her husband were in Australia. They actually both had COVID, but they're back in Plano now, and they have 8 friends who currently have COVID in Plano. And the way that all 8 of them got it was from their sons. There was an OU frat party. All of their sons go to OU. All of their sons went to this party, and then they went home and gave COVID to their mothers, and their mothers are all sick right now. And so you just never know how it's going to come into your environment, and you just want to make sure that we all want to make sure that we're keeping the seniors safe, because should they get COVID, it's not going to have a great outcome. All right. Anyone else have anything else to share? This is great discussion.
I was just going to say, so we're pretty much still on lockdown. So I haven't been necessarily going to I haven't been going to any of the events. So I love seeing that they're happening because that gives me hope that I will someday be able to participate again and see everyone in person. But I think that it's really important to be on these calls because you do have the opportunity to still get contact information for even new folks that you haven't had the chance to meet that have come on board in, maybe the last 3 months. The chat box I find extremely valuable. And I know that sometimes I've heard folks say, well, I pretty much knew everyone on that call. But you never know who they're going to share that list that's in that chat box. So please always put your contact information in it because I definitely use it and reach out to people.
Awesome. And I know we have a couple of other people who just joined the call and I just promoted them to panelists so that they could speak. Tamika, I know you just joined. Did you have any thoughts on ideas on ways people can network and stay connected to their referral sources? I know you're doing a podcast. Maybe you'd like to share a little bit about that with everyone. Let me see if I can find her here.
Okay, here I am. I'm unmuted. I actually just walked in and got on my computer. Yeah, home care assistants, we are doing the podcast, and I think the virtual meetings are a good way to communicate on a regular basis. The newsletter, social media, checking in, whether if it's every other day or every 2 days, keeping your business, your name out in the community, letting individuals know that you are still in service. If you have any special offers that you are promoting during COVID, I know some people are promoting certain offers. And I mean, of course, just old school telephone usage, basically.
I think you bring a good point about using the telephone as well. I think we lost you, Tamika.
No, I'm still here. I'm still here.
All right. Well, thank you for sharing that.
You're welcome.
Is there any other discussion? Any other thoughts? Cecilia from the Overton shared something. Cecilia Overton from the forum shared something. Cecilia, did you want to share that with the group? Let's see if I can find her. Here we go.
Okay. Can you hear me okay, Kathleen? Oh, okay. Well, we just bought these courtyard canopies about 10 feet by 20, so that now we are just starting to open up. It's a place where residents can visit with their loved ones safely, of course, socially distanced and so forth. And then also a separate area for maybe to start having professionals come by and pick up those cocktails or food or dinners or whatever. We're just now getting into this, but we're kind of excited. And then Jenny Madden gave me an idea. Maybe we could all do a Zoom with our pets. Since you're talking about relationships, Cathy, getting to know one another, I would love to see everybody's pets. Wouldn't that be fun?
Sure.
That would be fun.
Mine is sometimes on the call with me. He's leaving me alone today because I entertained him just before the call. But sometimes he's bothering me. Leave me alone. So, any other thoughts? So Jennifer Florence says she loves the pet idea. Someone is talking about the grilled cheese food truck that's happening later this week, and how they're going to be donating to a nonprofit. So that's a great idea too. Cindy Powell shared something. She said at her mother's memory care, they send WhatsApp photos throughout the day. And Cindy, is that every day or is it just every once in a while?
Hi, it's every day, all day, and it just depends on which staff member, maybe they're what they call sunbathing, or if they're having ice cream. It's a real well-connected community, and then the residents' family members respond back. So they've kind of connected, and then they've gone and met and done 6 feet apart to kind of support each other as people have gotten sick and recovered. But the WhatsApp is pretty cool. I look at it before I go to bed at night.
Okay, awesome. Well, thank you for that. Thank you all for participating in the roundtable discussion. I really appreciate that. I think we got some really great ideas from it, so thank you. Just want to share with you all that Seniors Blue Book has been in Dallas now for 5 years. Our new book is out. Our Discharge Planners Resource Notebook is also out and available. You can have them digitally online. They're available. If you want to send them to your referral resources via a digital file, just send me an email and I'll make sure that you get that. Or if you want to have print copies to hand deliver or to send to them also, just let me know and I'm happy to send them to you or get them to you in whatever way works for you safely.
Kathleen?
Yes?
Hello, Kathleen. It's Dr. Pat Grantham here. I had a quick question about your Senior Mania. Through your Blue Book, Senior Blue Book, could we get some more information about that, please?
Yes, absolutely. Definitely. We'll send some information about that.
Awesome. Thank you so much.
You're welcome. Also want to share that we have another event tomorrow. It's another webinar. It is with CC Young. Jennifer Broadway is going to talk to us about challenges of hospice care during the pandemic. It's again tomorrow at noon. So if you haven't got the invite for that, let me know. Just send me an email or just put a note in the chat. I'll make sure that you get that invite as well. We'd love to see you there, and I'm looking forward to what she has to say. And I just want to thank you all for being here and participating, and I'll be sending out my Marketing Mania invites in the next couple of weeks as well for our July program, so be watching for that. If you have any ideas on ways to connect and you want to partner with Seniors Blue Book, please also email me. I'd be more than happy to help with that as well. So thank you all for coming today. Thank you, Cathy Hefko, for your great presentation and for the discussion that we had. And thank you to Jen Griffin with CC Young for helping put it together.
Thank you.
Thank you all for being here.
Thank you. Thanks for joining in.